For the past 40 years, I have been interested in developing new drugs for the treatment of rheumatoid arthritis. I developed a clinical trial program at the Brigham Women's Hospital to study new drugs. We were most successful in the development of a drug called methotrexate, which has now become the standard of care worldwide in the treatment of RA. As a young medical student, there are a lot of areas that you go into. In my case, I had a mentor at the University of Maryland, Gene Jackson, who came actually to the Brigham and was one of our beloved rheumatologists, directed me towards this disease and this disease area. Patients with rheumatic disease, many of them have systemic illness that involves multiple organ systems. It's a fascinating specialty, and her personality and care of patients and her interest in patient care is what drove me into this field. So the issue in rheumatology is that very few patients actually with these diseases end up in a hospital setting. And as a medical student, most of the patients you see are inpatients, not outpatients. And you develop a long-term relationship with your patients because we don't cure these patients. We treat these patients, and I have patients now that have been following for over 30 years. And when I see a patient with new onset rheumatoid arthritis, I'm quite confident that we can stop their disease and allow them to perform their normal functional activities. I see patients that are professional athletes with rheumatoid arthritis, triathletes that continue to participate, patients who are involved in physical labor that can do their jobs. So there's no reason to expect if you have this disease with new onset disease that we can't stop it and allow them to do all the things they want to do in their life.